My name is Manpreet Sachdev, and I graduated from the School of Global Public Health in 2019 with a master's in public health. I work at the Center for Employment Opportunities in New York, and my title is Senior Associate of People Analytics. So I currently work at a national nonprofit that focuses on providing evidence-based employment programs to those who are coming home from incarceration. And so in my current role, I really leverage data and feedback to design both employee and constituent-centered engagement programs with a special focus on equity and inclusion. And so I kind of think of my role as at the intersection of both data and strategy. I kind of ultimately see my role as supporting the coaching and the work that we do for those that are coming home to their communities after some time. While I was completing my master's in public health, I chose to concentrate in public health management because I knew I was interested in pursuing a career where I kind of would have a hand in strategy, data, and program development. One of the biggest, I would say, soft skills that I learned during my time at NYU was how do we kind of equip leaders and senior leadership at an organization to use data to make the decisions. When I began my master's in public health at NYU, I was working at a hospital in New York City where I really focused on managing the social determinants of health program. And I remember at that time, I had one particular professor, Dr. Chris Purnell, that explained how the very same social, financial, and health inequities that I focused on in hospitals also existed in, a plethora of other overlooked communities. And so we spent the next couple of classes discussing mass incarceration as a public health issue and how there's, subsequent inequities that population faces as returning citizens. Getting that introduction and connecting it to my previous work experience in the hospital really led me to where I am in my current role. When I think about, what's the one thing I wish in public health could be changed with a magic wand, I definitely see accessibility of resources, of opportunities, everything that's made for the public, but at the current state isn't made as accessible as it could or it should be. And so when I think about, my role in particular in my organization, it's thinking about accessibility of opportunities and resources for those who are coming home from incarceration. I'm still very early on in my career, but I found it to be so fulfilling already. I think sometimes in public health, it can be an uphill battle where you feel like you're always coming across another barrier or you're facing another roadblock towards whatever goal you're trying to achieve. But what I found keeps me motivated is really to be able to get that one-on-one connection time with the people that I'm trying to impact. And though my role is more internal facing and it's, really focused on data and strategy, just have a chat with people who are impacted by our program is what really keeps me motivated. Of course, New York City is kind of at the intersection of public health in the sense of New York City has all the different types of public when you think about public health, whether that's race, culture, ethnicity, socioeconomic status, different languages, all those different things and even more. And so going to NYU and GPH program almost forces you to understand and grapple with the unique challenges that all of these different groups of people might face. I think what makes NYU's GPH program so unique is that although you are in a specific concentration and are really learning unique skills, you're also able to leverage them across different functions, across different industries and sectors. So I would definitely recommend GPH as an amazing kind of foundational environment for you to build on those skills that you will apply regardless of which sector of public health you decide to pursue.